Away from that, Coordinating Minister of Health and Social Welfare, Professor Ali Pate, has told African leaders that Nigeria is leading by example in the health sector investment and reform as it expands primary health care and improves national health insurance coverage. The coordinating minister mentioned the policies of President Bola Tinubu, who serves as the AU's champion for health, has enabled the expansion of health workforce quotas for training health workers to increase from 20,000 to 64,000. Professor Pate represented President Bola Tinubu at the African Union's Ministerial Executive Conference in Addis Ababa, Ethiopia.
For us in Nigeria, if I may use Nigeria as a case example, we took on an effort to scan around the world and look at the continent. And we looked at Ethiopia, we looked at Tanzania, we look at Rwanda, we look at many countries who are outliers to understand what have they done well, what have they not done so well. They did a thorough diagnostics of our own healthcare system, our own burden of disease. We surveyed our population, used the People's Voices survey to understand what are the needs of our citizens, what is the market, and then talk to our partners, external partners, to understand what are they doing. Because in reality, much of what was happening was outside the purview of government, even though it was happening in our respective countries. And then we came up with a mission to save lives, to reduce physical and financial pain, to produce health, and to do it for all Nigerians. In other words, translating the core essence of the UHC agenda. And decided that this technical part is important, but it's not necessarily the first and most important. So the governance pillar first had to put government at the front of it, had to mobilize our domestic resources and restate the role of government as being responsible, the sovereign entity responsible for the health of the population, not in isolation, but in collaboration. And so signed a compact with all our partners and within our government, these 36 state governments, plus the federal government, to agree, this is our ask, this is our offer. Because until then, there are multiple actors who were operating, helping strengthen primary health care, but primary health care was not getting strengthened.